Hello and welcome to today's Sport Medicine, Exercise, Rehabilitation and Performing Art Medicine MSc Programs Open Day, virtual Open Day. Thank you very much for joining us. My name is India Dean Smith. I am a guest student here at UCL and your chair this evening. We hope this session will address those course-specific questions you may have and will help you to gain insight into what it's really like to study on one of our master's programs. I'm delighted to welcome today's speakers, Professor Courtney Kipps, Dr. Hara Truly, and Professor Helen Birch, who will provide you with a summary of their MSc programs, and there will be a Q&A session for the second part of the event. This session is being recorded and will be made available on our website following today's event. Now to introduce our speakers. We first have Professor Courtney Kipps. Professor Courtney Kipps is a consultant sport and exercise medicine physician at the Institute of Sport, Health and Exercise at UCLH and co-leads the MSc Sport in Medicine, Exercise and Health at UCL. We have Dr. Hara Truly, who is the course lead for the UCL Performing Arts Medicine MSc based at the ISEH at UCL. And we have Professor Helen Birch, who is Professor of Skeletal Tissue Dynamics at the Institute of Orthopedics and Musculoskeletal Science at UCL. But before I hand it over to Courtney, I'm just going to share a quick poll. So if you can just let us know which course you are interested in applying for. So the options that we have are Sport Medicine, Exercise and Health MSc, Performing Arts Medicine MSc, and Physical Therapy in Musculoskeletal Health and Rehabilitation MSc. And if you're not sure yet, then you can just select not sure. So I'll give you a few seconds to fill that out and then I'll read out the results. So thank you for all of you that have voted in the poll. So we have the results now. We've got 6 voted for Sports Medicine, Exercise and Health MSc, 3 for Performing Arts Medicine, and 5 for Physical Therapy in Musculoskeletal Health and Rehab. So thank you very much. We're now going to hand over to you, Courtney, and we also have 1 who voted for not sure. So we're going to hand over to you now, Courtney. Thank you very much, everyone.
Good, thank you, India. So welcome everybody, and welcome to those who are interested in studying sports medicine, exercise and health at UCL. I think it's a great choice, and I think you'll find that the staff at UCL are really passionate about this. And with that in mind, I want to take you through a little bit about what you might find at UCL. So quickly then to discuss what I'm going to talk about, the specialty of sport and exercise medicine, what you can do with your degree, what you'll learn at UCL and how you'll learn, why you should consider UCL as a university, and if you then decide that you'd like to study with us, what you should do next. The specialty of sport and exercise medicine is genuinely a multidisciplinary specialty. It's one of the few truly multidisciplinary specialties where we will have physios, doctors, sports scientists, rehab therapists, osteopaths, chiropractors, podiatrists, strength and conditioning coaches, nutritionists, psychologists, coaches, athletes, parents, all working together to look after our athletes. It's a genuinely, truly multidisciplinary multidisciplinary discipline. And with that in mind, we keep all of our students together. We teach them all together, and they learn everything together. And they're all taught the same content, expecting that they'll be working together in the big wide world afterwards. The specialty is governed by a number of organizations, including BASM, the British Association of Sport and Exercise Medicine, ACPSEM, the Association of Chartered Physiotherapists in Sport and Exercise Medicine, BASES and BASRAT for sport and exercise scientists and rehab therapists. And undoubtedly, you will have come across those organizations already. If you haven't, if they're relevant to you, go and have a look at their websites and get a feel for what you in your discipline would be doing once you've had finished your degree in sports medicine, exercise, and health at UCL. But if it doesn't show up on their website, let me then tell you a little bit about what you can do. Most people will be going into some form of clinical environment afterwards, where they'll be seeing patients. They might be in an NHS clinic, like I was this morning. They might be in a private clinic. They might be in a club working with players in the club, seeing them in the medical room at the club. And so whether it's a team or a club or whether it's an amateur team or professional team, whether it's a national team or your weekend football club, you'll be looking after the same kind of injuries, perhaps in slightly different settings. But many others will be doing other things as well. Some will be working at events, perhaps like the London Marathon, which is coming up in a couple of months' time. Some people will be going on expeditions as a medic on an expedition. Two of our students last year went away with the military on expeditions to the Himalayas. Neither of those were army doctors, but they went along as the doctors on those trips. And their MSc enabled them, gave them the skills and experience to be able to do that. Some will be teaching, like I've been doing today. And in fact, if I think of our staff, 2 of them have done our course before. Some will be advising the local government or advising the public health department, perhaps advising the national government. Some will be advising national governing bodies in sport. And some will be doing research. In fact, everybody who does their MSc will be doing a research program. If you're doing a postgraduate diploma, you might not be doing the research program, but thereafter, once you've completed this course and you've got an MSc, you'll be in a position where you can build on your research or take on additional research if you're interested. So what is it that you will learn in our course at UCL? Well, to begin with, as you might expect, sports injury diagnosis and management. That's probably the mainstay of what we teach. And we have 3 modules on sports injuries: lower limb, upper limb, and head, neck, and spine. We also have a sports injury rehabilitation module. And we have a team and event medicine module, which is learning about sport and exercise medicine in a team setting or at an event, whether it's a mass participation event like a marathon or a multi-games event like the Olympic Games, Commonwealth Games, etc. You'll have a module on exercise physiology. You'll have a module on prescribing exercise as a medicine for those with chronic or non-communicable conditions, and a separate module on injury and illness prevention, which is a big and getting bigger part of what we do. And then finally, everyone will do a module on the principles of research, and MSc students will also do a dissertation. They will put together a research project themselves. So how will you learn at UCL? Well, you'll learn either as a full-time student or a part-time student or as a modular flexible student. Full-time, as it says on the tin, that is, you are a student for 1 year, and most people are not going to be doing anything else because there's a lot of studying to do. Part-time is a 50% study, and 50% is your own time, and many people will continue their day job working part-time. Modular flexible is the part-time is over 2 years. Modular flexible is anything between 3 and 5 years. Perhaps doing 1 or 2 modules per term for the first couple of years and then staggering them for a few years, or the other way around. You can also learn on campus as a campus-based student or as a distance learning student online. You can do that from home or from wherever you choose to do your learning. Our distance learning students can attend our teaching online, and we will stream our lectures live, but they'll also come in for a couple of days per module in April and May to come and learn the practical bits which we can't properly deliver online, in which case we will teach you on site here on campus in April and May. The exams for everybody will be exactly the same, whether you're a campus-based student or a distance learning student, whether you're part-time, full-time, or modular flexible. So why then should you consider UCL? Well, UCL, as you probably already know because you have joined this call, is one of the very best universities in the world. It was voted the University of the Year by the Times and the Sunday Times. It's also 9th in the world in the QS World University rankings. And there have been more than 30 Nobel laureates amongst the staff and alumni. Why else would you come to UCL? Because we have the Institute of Sport, Exercise and Health at UCL. And that is where it's an IOC and Department of Health funded organization, which provides teaching, research, and clinics to injured athletes. And so here you'll be learning with experts in their field in the center of London, really at the heart of sports medicine in the UK. And as I've already mentioned to you, our faculty genuinely are expert and genuinely are passionate about what they do. About half of our lectures are delivered by expert guest lecturers who we invite in to come and talk to you. And as an example, next week we will have the head doctor for the RFU coming to talk on the injury prevention module. And a couple of weeks later, we've got a doctor from the professional football team coming to talk. So you will be taught by genuine experts in what they do. We also have a wide variety of assessments to match everybody's learning style. We'll have some MCQ exams, we'll have some written exams, we'll have some presentations, some group presentations, only a couple of pieces of coursework, but they'll be in different formats. For example, an editorial or an infographic or a rehabilitation program. We'll also have posters and research projects to present. Ultimately, we have a different way to assess everybody so that everybody's learning and learning skills are accounted for. So you've decided that you want to come and study sports medicine here at UCL, and you've now got a little bit of time on your hands. What do you do next? Well, first of all, you'll have the opportunity to ask some questions later on. But after that, I would spend a bit of time reading up about the course, reading up about the discipline. And where can you find that information? I've already mentioned a couple of organizations for you to get in contact with. But you can also look at the journals, the British Journal of Sports Medicine, for example. And if you're interested, you can subscribe to a table of contents, which will come through to your email every month and tell you what's the latest research. You'll find many, many interesting podcasts and many, many, many interesting Twitter feeds. Social media is awash with sport and exercise medicine. And if you just keep your eye on what's happening, you will start to get to grips with the terminology and you'll start to understand the nuances around the discipline. There's several conferences that you're welcome to attend, and there you'll meet others in the area, others who perhaps have gone through this course and have an opportunity to talk to them, and others who've gone on to different different aspects of sport and exercise medicine, where you can ask them, pick their brains, and they can help you navigate your way through sports medicine. If you have an opportunity, go on a pitchside course, such as the RFU's course or the FA's pitchside medical course. The RFU course is called the Pre-Hospital Immediate Care in Sport course, and the FA course, I believe, is called the Area course. Both of those will teach you how to manage pitchside injuries and will enable you to start working pitchside. We'll teach you all the rest there is to know about sport and exercise medicine, but those two courses will enable you to work beside on the pitch at a rugby club or a football club. And if you want to start getting that experience, there's nothing to hold you back. And finally, if you're interested, do submit your application, because without it, we won't see it. I'm going to stop there, and I'm going to hand over to Hara. I'll be around to answer questions afterwards. I believe the questions will go up if you type them up into the question answer box, and then India's going to throw them back at me afterwards. I'll stop there and hand over to Hara.
Thank you very much, Courtney. Thank you. And a big welcome from me as well from here at UCL. It's afternoon in London, just getting a little bit darker. So from wherever you are watching this open virtual webinar today, welcome very, very much indeed. So I'm Hara. I'm the program lead for the Performing Arts Medicine. And I'm going to try in a few minutes to talk to you about this discipline, this area of medicine, performing arts medicine, which for a lot of you may not be so well known. And then I will talk a little bit about our program here at UCL. So allow me to share my presentation. So I assume you're looking at my screen. Performing Arts Medicine, we have a program with a master's, a diploma, and a certificate, all postgraduate degrees. And we belong, like my colleagues' programs here today, at the Division of Surgery and Interventional Science, one of the big divisions, medical divisions at UCL. And we're absolutely thrilled that we have maintained this position for the last 12 years. And I would say that we are still remaining the only postgraduate such course internationally. So it is quite a prestigious position for us, and we are ever so grateful. So if I try and change my slide. A little bit about performing arts medicine. It is a unique field, as I already said. The professionals, again, a little bit like sports medicine, it's a very multidisciplinary area of medicine. So it involves medical doctors, various scientists from my biomedical background, physios, osteopaths, chiropractors, sports therapists. If you're coming from other countries with different sort of degrees, such as athletic training or kinesiologists, we also involve in our work psychologists, speak and language therapists for voice disorders. And we look at some other sort of scientists, such as dance and music scientists these days. There are degrees out there that give undergraduate degrees or even postgraduate degrees in dance and music science. And also we look at educating educators themselves, educators of the performing arts themselves. And we do care for whoever comes under the performing arts label. It can be a musician, a dancer, a circus performer these days, singers, actors, and many, many others. So as I said, we are 12 years here at UCL, and we still remain the only master's at master's level program. We're very closely associated with the UK association. It's called BAPAM, British Association for Performing Arts Medicine. You see the top, I've just put a little screenshot from the website there, which is an association that has a lot of information for those of you who may have an interest to learn a little bit more about the specialty. Please log in into their website. We're also very closely associated with PAMA, which some of you may know a little bit more about. It's the biggest international organization based in the United States, but with a true international membership. And I have put this excellent announcement here that for the first time, the international conference will be hosted outside the United States, and it will be here at UCL this coming July. So if you really want to come and see us from a little bit closer, we will be here. We're here anyway, but if you want to come to a brilliant conference that we're trying to put together, this is for this coming July. Just to give you an idea, just a little bit of a visual there with some books from our reading list. There is quite a bit of bibliography on this now, much more than I'm showing you here, but I'm just giving you the breadth of the artistic disciplines that we cover, from voice, dance to musicians, circus, and many more. There are also a number of journals that we aim to publish in. So us as members of staff, but also our students, particularly our master students, if they wish, they can pursue a publication in one of these journals. There is a dedicated journal, which again, you're very welcome to look up. Some of the articles are free on PubMed or whichever other way you want to look up your papers. Medical Problems of Performing Artists. It's published in the United States, but there are some other journals, for example, the Journal of Voice that we publish in, the Journal of Dance Medicine. This is the French publication, in occupational medicine, and occasionally in the British Journal of Sports Medicine as well, that my colleague Courtney just mentioned. I'll talk to you a little bit about the course itself now. We have 3 levels. We have the certificate, the diploma, and the master's. In the postgraduate certificates, we have 4 modules. That's 60 credits altogether, and it's only distance learning. So you will do this between end of September to end of March. This is when all the lectures take place, and then we have our exam period in April, May, and June. You can do it in 1 year, or you can do it in 2 years if you want to be a little bit flexible with your modules. Then we're moving on to the next degree, which is our postgraduate diploma. We offer 8 modules altogether for 120 credits, and it is a blended program. So we have distance learning options, again, with online lectures between September and March, and then we have residential weeks, usually in May. Of course, our exam period will follow. And finally, we have the master's, the MSc, which is 9 modules, a total of 180 credits. It's a distance learning option with the residential weeks and with the research project. So the research project is the difference between the diploma and the master's, and this is the one that perhaps is for those that have an interest in doing some research within this area, perhaps presenting and publishing later on. The master's, one can do it in a year if you really have the time, because it's very full on and it will take a lot of your weekly commitment. You can do it in 2 years as a part-time student, or again, you can choose a flexible option to spread your modules to up to 5 years. We always start in September. Just a little glance on our modules. We have 4 modules that actually everybody will come and do. Performance psychology, science of dance and circus, the science of the instrumental music and voice, and occupational risk factors. These are the 4 modules that we will offer to all our students, regardless of the degree that they're studying for. Then moving up to the diploma and the master's, we add musculoskeletal injuries, pain and disability. We do clinical assessment and rehabilitation of our musculoskeletal injuries, and also we join the division-wide research methodology module that all our master's students take in the division of surgery. And finally, for the master's, we offer the research project, ends up with a written dissertation that is for 60 credits. We don't have any optional modules, so all our modules are mandatory. And if you are a health practitioner and you want to start with, let's say, a postgraduate certificate, you have the option to upgrade later on to a diploma or a master's if you so wish. So we have online modules. Every module is about 25 to 30 hours of teaching time within the term. The lectures are recorded asynchronously and uploaded on our teaching platform, Moodle, that we have here at UCL, as I said, between October to March. There is ample opportunity for independent learning. We have forum discussions that are ongoing all the time in the background. And we do have live sessions that we give you some notice for, and we come all together online and we have various discussions on our modules. As I mentioned earlier, the diploma and the master have 2 residential weeks around April or May time, where everybody comes to campus, and it's really a celebration of our program. We do have some exams then, we do have some practical workshops, but we also have a lot of social time and an opportunity to meet each other, network, discuss your future, do a little bit of career advising, and all the rest that you can imagine. I think we've done those residential weeks now for 3 years, and they're very, very successful. In terms of how we assess, we have, again, a variety of assessments from essays, blogs, infographics. We have written examinations here on campus. We have clinical examination, the OSCEs, the objective structured clinical examinations. And of course, we have the big dissertation that is written at the final year of the MSc. Who is eligible to come to our program? For the diploma and the MSc, you will need to have a medical qualification, MBBS in this country, in the UK, or equivalent from other countries, or you can be a physiotherapist, an osteopath, a chiropractor, nurse, coming from sports science, or other biomedical sciences or athletic training. For the certificate, you can be all of the above, but you can also be a psychologist, a speech therapist, or a graduate of performance science and performance education. In terms of where we're going to with this master's, we really give you this in-depth knowledge of what is going on and how we treat and look after the performing artists. We give you these specialized skills, I would like to believe, that you can confidently incorporate in your own professional practice. But you can also join what I will call in general the performing arts clinics. These can be independent clinics. These can be in-house clinics within music, dance, or circus colleges. You can work together with orchestras and dance companies, musical theater companies, and some of our graduates work also in sports medicine clinics, particularly those affiliated with the more physical arts like dance and circus. And these days, the big circus school offer medical or physical therapy services as well. If you like to educate, you can join us or perhaps other small programs that exist in performing arts medicine. You can do further research, for example, on a project that you have already selected with us, if would you like to carry on, or you can do academic studies at a higher level, such as a PhD. So I will leave you with this. Come and join us if you wish to speak to us. These are the 2 emails down here that you can reach us at. You don't have to do the application. You can have an informal chat before that. But even if you do the application and you want to talk to us one-to-one, you're more than welcome. We can always arrange an online meeting and see what exactly we can help you with. So I'm going to leave you here, and I'm going to pass on to my colleague, Professor Helen Birch, talk to you about her program. Thank you very much.
Hi, thank you, Hara. I'm going to start by trying to share my screen, so if you can just bear with me. Okay, so hopefully you can see my screen now.
I'm unable to see your screen, Helen.
Ah, okay, hold on. Let me just try that. You're still not seeing it?
No, great. I can see it now. Thank you.
You can see it. Lovely. Okay. Okay. So, hello, everyone. My name's Helen Birch. So I'm the programme lead for physical therapy in musculoskeletal healthcare and rehabilitation. So just to tell you a little bit about myself, I have a degree in biochemistry and physiology, and then I went on to do a PhD in tendon research. So my particular interest is in tendon biology and degeneration and tendon injuries. I'm also clinically trained as an osteopath. So moving on to our programme, I can change my slide. There we are. So about the physical therapy in musculoskeletal health and rehabilitation, MSc. So we take a different approach to other physiotherapy masters programs. So we teach you about the fundamental science that forms the foundation of physical therapy and the techniques used to treat musculoskeletal pain and dysfunction. So rather than teaching you a sort of list of techniques for various different conditions, we think that if you have a good understanding of how musculoskeletal tissues work, right from cells to tissues to the whole musculoskeletal system, you'll be able to choose the most appropriate techniques to use. So treating each person as an individual, be able to modify techniques and even develop new techniques. So that's the rationale behind our programme. So the MSc is run from the Department of Orthopaedics and Musculoskeletal Science, and that's where I'm based. And we're out at Stanmore on the site of the Royal National Orthopaedic Hospital. So you'll be taught by UCL academics who are actively involved in world-leading research, covering quite a range of activities, from cell and matrix biology to biomaterials, mobility devices, human-machine interfaces, etc. So quite a rich background of research within the department. Then alongside that, and particularly because we're based at the Royal National Orthopaedic Hospital, you'll be taught by specialist clinicians from the hospital who will be able to explain the clinical application of specialist rehabilitation techniques. So the structure of the programme. So the programme is made up of 8 compulsory taught modules. Each of those modules is worth 15 credits. And you'll take 4 of those modules in term 1, and then another 4 modules in term 2. And the way we run it is that we have the each of those 4 modules that you can see will run throughout the first term, and we teach you 1 day a week for 10 weeks. So this is particularly good for students who may want to study part-time. It allows them then to work alongside their study. So in the first term, we will teach you about musculoskeletal tissue biology. So we're going right from the cell level, and we talk about how cells respond to their environment, particularly their mechanical environment. We talk about the molecules that make up the extracellular matrix, and we talk about how those are put together to form each of the musculoskeletal tissues, and we think about how that structure relates to the function of those tissues. The next module on musculoskeletal biomechanics and application in physical therapy. That will teach you about the underlying sort of physics of movement, forces, joints, movement, etc. And then in movement science and pain, we look at movement in a more systematic whole way, and we look at things that will influence the way people move. And one of those important things, of course, is pain. So you'll learn about mechanisms involved in pain, chronic pain, etc. The research forms a strong part of the whole of the MSc, and so alongside the modules, you'll take modules that will teach you about the methodology used in research and the sort of skills that you're going to need to develop to carry out your own research project. So in term 2, carrying on with our taught modules. So these follow on really from the modules that you have in term 1. So we continue with musculoskeletal biology, and we talk about when things go wrong, so about the disease and dysfunction of those musculoskeletal tissues and what's happening at a cell and a tissue level, and how that then relates to the sort of symptoms that people will see. You'll also do a module on the clinical aspects of musculoskeletal medicine. So this will teach you about how the musculoskeletal disorders are approached with medicine and surgery. And this will be taught by our orthopedic clinician staff at the RNOH and within the department. You'll take a module that is run by the physiotherapist based at the hospital, and that's called Rehabilitation and Multidimensional Patient Management. So that really talks about how you approach different musculoskeletal problems that you might see in your patients with a physical therapy approach to their rehabilitation. And then following on with the theme of research, you have another module which covers the governance around research, such as the ethical approvals and all those sort of various things that you have to manage when you come to do your own research project. In the third term, this is where you get to put those skills you've learned into practice, and you'll carry out your own research project. So each student will be able to select their own individual project, so this will be something new and novel that hasn't been studied before, and we put forward a number of project proposals, so students are able to go through those and choose something that they are particularly interested in. So we have a wide range of different projects available. Some of them are based in the laboratory doing experimental work, or it might be a more clinical study looking at clinical data, or sometimes interacting with patients. Or you may prefer to do a literature review, so a systematic review. But really you have the flexibility within your project to follow something that you're particularly interested in. So I've just put a few examples there. These are some of the titles for the projects that students are going to be doing this year. So they haven't started yet, but if you have a read through those, you'll appreciate that there's quite a wide range of different types of projects available to students. So assessment is something that students always are keen to know about, and we look at this in various ways. So what we try and do with the assessments is, as we appreciate, it's not just about giving you a mark for your MSc, but the assessment is an important part of directing your learning. And so we try to build on the skills that you acquire throughout the course by setting different types of coursework. We set different a wide variety of types of coursework so that you can develop your skills in different areas. And we try and make these sort of real life things that you see. So just some examples here. So we have multiple choice question exams. We have various different coursework. So this might be a narrative review. It might be a question based around a set of data that you'll need to analyze and evaluate. We have case studies. And some of that will be presented as a poster, so that will develop your skills in making posters and presenting those. And then finally, the research project, that's written up as a thesis, and you'll also have a Viva exam on your research project. So what sort of students might we be getting on this programme? Who is going to benefit from this programme? So we don't restrict it to physical therapists or physiotherapists. So first of all, we have a range of therapist types. So they may be physiotherapists, or quite often, if they're international students, they have a different title, rehabilitation, therapy, etc. Osteopaths, chiropractors. We have medical professionals, so it could be a GP, it could be a nurse. We have students who have a sports science background, and we also have graduates from sciences. So any sort of biomedical science, or even a bioengineering background, then those students are able to join our programme. So the main thing really is for students to be interested in the musculoskeletal system and the healthcare of that system. So you may be wondering what you might be qualified to do at the end of the programme. So a big part of our programme is to build your skills. So particularly your ability to analyze information, to evaluate information, and to be creative in your thinking and be able to come up with new ideas. The careers that students go into after doing this MSc are really quite varied, and a lot of that will depend on their background before they come to the MSc. So obviously, to go into physiotherapy, either within the NHS or private practice, then you would need to have previous qualification, clinical qualification as a physiotherapist. But quite a lot of our students do, and they find that this MSc will boost their knowledge and their understanding of the underlying fundamental science to what they're doing. So it could be working clinically. Students might want to go into education. So some of our students have gone on to be lecturers on other physiotherapy master's programs, for example. Students might want to go into academia as a researcher. Quite a few of our students go on to do a PhD in various different areas. You could, for example, go into health service management. You could go on and be a sales representative for a rehabilitation type with a really you'll be qualified to do a real broad range of things, anything that requires somebody to have good analytical and evaluation skills. So I think that brings me to the end of my presentation. So I'm going to try and stop sharing my screen now, if I can find the right button.
Great. Thank you so much, Courtney, Hara, and Helen, for this very informative session. All these courses sound very interesting. We will now start our Q&A. So please, everybody, add your questions to the Q&A box and I'll read them out. If your question is for a specific member of the panel, please do indicate it in your question. And we've already had some questions coming in whilst the presentations were going. So our first one is for Courtney. And the first question is, what are your basic general requirements? Can anybody from a bachelor background of psychology be eligible for the program?
Thanks, India. The basic requirements are a clinical degree. And so most commonly that'll be a medical degree or a physiotherapy degree. We also accept osteopaths, chiropractors. We have had a couple of nurses and we sometimes have rehab therapists. We have indeed had one psychologist many years ago, but we tend to find that it's a very clinical and hands-on degree, which may not be that relevant to a psychologist and to their future career in sports psychology. So that's the kind of thing that I would be happy to talk about separately, and we'd certainly be very happy to have a conversation about that at a later date if required.
Great, thank you. And then we also have the same question here for Professor Helen Birch. So what kind of a profile in students are you looking for, as in what are the criteria for application for a musculoskeletal medicine program?
We don't specify that you have to have a clinical qualification. So a lot of our students do. So the obvious one is physiotherapy. But we have various different clinically qualified students coming on our program. But really any sort of degree in biomedical science. So we need to know that you have the background to understand the biology involved in the program. There's a little bit of maths, a bit of physics in understanding the biomechanics. So those are the judgments that we have to make, really, is whether we think the students would have a sufficient scientific background to be able to handle the program. I mean, what we find, because we have, we teach really right from cells to the whole person and therapies and rehabilitation, depending on the background. Students who come in with a basic science degree will find some of the modules plain sailing and relatively easy. They will be pushed out of their comfort zone when it comes to the more clinical modules. And then vice versa, our physiotherapists find the cell and the tissue biology quite challenging, but then they feel much more comfortable in the rehabilitation modules. So it really just depends on your background. And we think that when you do an MSc, you should really be pushed out of your comfort zone. So there's no point in coming and learning things that you already know and feel comfortable with. We don't apologize for putting students into a position where they don't feel comfortable. It's new information and it is hard. It's hard work, but hopefully it's worth it in the end.
Okay, thank you. And our next question is, are there any examination criteria to be cleared for MSc Sports Medicine?
Thank you. I'm trying to work out if that question means before you apply for sports medicine, in which case the answer is no, other than having completed your undergraduate degree and have at least a year of postgraduate work experience, i.e., working in your field after graduating from your undergraduate degree. We don't require any specific exams for entry. Of course, there will be exams during the course, but I think this probably relates to entry criteria. We don't have any exams for that.
Okay, great. Thank you. And another question for you, Courtney. We've got for sports medicine, how many days a week in campus is it as a full-time student versus part-time? And also, can I apply for the course straight after graduating from my osteopath degree, or do I need any other requirements?
So the second part of that question I've actually just answered. You can't apply straight after finishing your undergraduate degree. We only take students who have been working in their field for at least a year after graduating. So if the potential applicant is graduating in July 2024 this year, then we would recommend applying to start the course in September 2025 or later. How many days a week on campus as a full-time student? Well, that will be at least 2 days, sometimes 3 days or more, depending on your research project. But our teaching takes place in person or online all day on a Tuesday and all day on a Thursday. Full-time students will attend both of those days. Part-time students will attend one or the other, and then they will alternate in their second year. But of course, it's not just the teaching that happens in the lecture room, it's all the learning that goes around the lectures. So there's a lot of pre-lecture preparation and post-lecture revision and review and forum discussions and group work, which takes up a lot more time than simply the lectures themselves. So whilst the physical learning in the lectures will only happen for a full-time student on 2 days a week, there is indeed 3 days a week of self-directed learning to take into account. And for a part-time student, cumulatively 2.5 days a week each year for 2 years.
Okay, thank you. And our next question is for Hara. So we've got a question here. I'm a physiotherapist holding a master's in sports, also a dancer. If I wanted to delve into the world of teaching at university level, like UCL or an arts university, would a diploma be a bonus and a facilitator for that, or would a master's degree in performing arts be required?
So we have somebody who already has a master's there. It sounds as if both would do at this, that would be my answer at this point. Perhaps we can have a conversation at some point if that is of interest. We do have a number, for example, people, lecturers and guest lecturers in our course that have masters and qualifications in other disciplines, other medical disciplines or other health disciplines. So it's a matter for discussion and just to see, where the academic sort of standards and the breadth of the knowledge stands there.
Great, thank you. And we have a question here for sports medicine. So can I apply if I don't have a sports medicine or physiotherapy undergrad? And what should I do in that case?
Well, it will depend on what the undergraduate degree that you have actually is. The course, as I've mentioned, is very clinical. It requires a lot of hands-on clinical examination. And so if your undergraduate degree is a clinical undergraduate degree, let's say osteopathy or chiropractic or sports rehab therapy, then those are courses which we would often accept. But if it was a non-clinical science degree, then we don't routinely accept those students. Now, I would actually stop and ask, and it's not necessarily appropriate to do it in this environment, but not appropriate for you to answer in this environment, but you're welcome to come back to me afterwards. I'd ask, what do you want to get out of the course? And what do you want to do when you graduate? Because our course will teach you how to examine a knee and a shoulder and how to manage the injuries. But it requires you to have an undergraduate clinical degree, which you can build upon. And what our course won't do is teach you to be something which you are not already. It won't teach you to be a physiotherapist if you're not already a physiotherapist. It won't teach you to be a doctor if you're not already a doctor. So we will take those students and we will make them into better practitioners of their current discipline, but we won't teach them to be something else. And in this country, certainly, one has to be a registered clinician to be able to call oneself a clinician. And so we will discuss quite closely with those who apply who are hoping to be something else. And my recommendation for many of those is go and learn to be that something else. If you're not already a physio and you want a physio career, go and learn to be a physio and then come back and apply to do our course when you are already a physio, because then we'll make you into a sports physio.
Okay, great, thank you. And our next question is for both Courtney and Vahara. So would occupational therapists be considered as an allied health professional? I have 20 plus years of clinical practice and I'm a specialist within brain injury and rehabilitation.
Vahara, do you want to go first?
Yes, thank you. Again, I think I would say that this would be a little bit more personalized on the application process, so somebody like yourself might need to come and talk to me or one of my team before you apply. Generally speaking, the occupational therapists, if you are involved in the area of performing arts or sports perhaps, and you have that clinical experience, that might be a criterion for considering the application.
Thanks, Hara. I can answer similarly. We would consider the application, but as I've just mentioned, I would want to have a discussion with you about how you hope to be able to use the learning that we will give you on the course in your own clinical sphere once you're finished. And for some people, it's perfectly logical, and for others, it might make them stop and think, is this going to be a good use of my time, effort, and money if I'm not going to be able to use it because my registration as whatever your discipline is, if my registration doesn't allow me to do those kind of treatments or refer for those kind of investigations. So we'd have a conversation about that.
Okay, great. Thank you both. And our next question is for Hara. What's the frequency of the teaching delivery per week on a part-time program, both 2 years of master or diploma and the flexible modules, so up to 5 years?
So every module is once a week. So we have a dedicated time that the module is taught, where we put the lectures online and the students can have a look at them, and all the other resources that we need to put on. So depending how many modules you have every week, the part-time will be 2 modules per week, if that's what your choice is. The full-time is 4 modules per week, but if you go on the flexible module option, then it could be 1 or 2 or 3 modules per week, depending on your selection there.
Okay.
I hope that's clear. Yeah.
Yeah, great. Thank you very much. And I'm just going to read out some of the questions that were answered in the text box. So our question here for the performing arts medicine, is there a time limit for an upgrade from the diploma to the master's? And Hara's kindly answered this. You would need to request an upgrade within the final academic year of your diploma, so up to April/May. And the final question for our performing arts medicine, what would be the deciding factors between a master's and a diploma on a practical level other than wanting to do research? And Hara's answered, in terms of lectures, you have exactly the same lectures. At MSc level, you also dig into research, which is an additional skill and will also give you opportunities for presentations and publications in the future. Otherwise, at admissions point, it's your choice which route you choose to apply to. Now, thank you, Courtney, Hara, and Helen for this very informative session. So everything is So we're out of time now and we'll need to leave it here. But thank you everybody that has joined today and for your questions. And once again, just thank you for an excellent session and have a great evening, everybody.
Thank you. Thank you.
Thank you very
Bye-bye.
much.
Thank you. Bye-bye.
Bye.